My name is Joanna Fink, and I am the ICU PCU Nursing Director in Hastings. COVID has been a huge challenge for us. I think it's been a huge challenge for everyone. There was a lot of unknowns with COVID that we had to adjust to, but we had really good support, really good team. We saw a lot of really sick people, and it was very challenging through the spring and into the summer. But then in the fall of 2020, especially in October and November, COVID took a huge spike up. We had our most COVID-related deaths in November. We had our most COVID admissions in October and November. November was a huge challenge for the nurses and for the providers and all those caring for COVID patients because the patients were so sick and a lot of them were dying. The community just really kind of came together to kind of help protect each other. We wanted to take care of these patients. That's why we are nurses, is because we care for other people. We want to make everyone better. We had really good support here in this area. We were able to get the equipment we needed to take care of the COVID patients safely. We had a really awesome team with infection prevention, and our providers were just right there with us. I tested positive for COVID in November of 2020. So we were quarantined at that time for, I think it was about 14 days for our whole family. With COVID and being pregnant, my biggest fear was just for the baby and the unknowns. I didn't know what COVID is going to do long term for this baby. I didn't know if it would make me sicker having COVID and being pregnant. So there's just a lot of unknowns. This third pregnancy feels very different than the first two. There's a lot more stress in my life because of COVID. I got connected with the maternity care management program. They reached out to me because I was on some medication to help prevent preterm labor. I was really struggling getting the medication company to send the medication on time. And so I'd reached out to Blue Cross Blue Shield to kind of see what I needed to do to make sure that this medication was getting delivered correctly. And they connected me with the nurse manager, Jenny. She checks in with me weekly, if not more often, and just kind of asks how my appointments have been. There's a person. It's not just an app or a program, or it's not just someone who cares about you because they have to because they're your insurance company. Like, she really does care about me as a person.
With a member like Joanna, who has actively worked in a hospital during this pandemic, I really feel I understand the stress that she's feeling and being pregnant with a high-risk pregnancy, and I really do care. I admire her. I think she's a remarkable woman, and it's just amazing that she has just got up every day and gone to her job, and this has to be the most stressful year that she's had in the hospital, and to throw a pregnancy on top of it is really, quite amazing.
Knowing that this baby came at a time when the world was so unsure. There was so much death this last year, and then now this year we have so much life. It's kind of the way the world works, and it's just a huge blessing that God gave us, that we made it through this really crazy, crummy year, and 2021 is going to be a positive year of life and birth, and it's going to be amazing. That's what we'll tell this baby.